Hello, thank you for visiting Children's Emergency at KK Women's and Children's Hospital. Your child has been diagnosed with hives. We have put together this video to help you understand more about this condition, why it happens, prevention methods, and what medications can be used in the treatment of hives. What are hives? Hives, or urticaria, is a type of rash. They usually look like red, bumpy, swollen rashes that are usually itchy.
It can be due to an allergic skin condition, but can be caused by other things as well. In some children, they can be triggered without any reason. While most hives episodes last a short time, some children can have chronic hives that can last past 6 weeks. What causes hives? There are many things that can cause hives. Some of the more common things that can cause hives are infections, especially viral ones, spontaneous, meaning that we cannot identify a trigger or a cause for the hives, or contact allergies to plants, animals, and chemicals. They can also be part of an allergic reaction to food or drugs. Some children can have chronic hives that can go on for weeks to months. These are usually not due to any allergies. Some things that make these conditions worse are physical triggers like pressure, temperature, physical exercise, direct sunlight, and even stress. In some children, there may not be a clear cause for what causes hives. What is angioedema? Sometimes children may have angioedema associated with the rash. This is a swelling that usually occurs in the deeper layers of the skin. Unlike hives, it is usually not itchy. It can involve eyelids, mouth, and sometimes even genital areas. In rare cases, angioedema can be associated with severe stomach cramps and breathlessness. In such situations, it may be related to a genetic condition and requires immediate medical attention. Most of the time, hives and angioedema are not harmful. Hives can also be part of a serious allergic reaction called anaphylaxis. This is not as common. In children who experience anaphylaxis, the rash is associated with difficulty in breathing, abdominal pain or vomiting, and changes or hoarseness to the sound of their voice. How are hives treated? In mild cases of hives, they don't need to be treated and they can get better on their own. Finding out the cause of hives can be useful. We may need to delve back into what happened before the rash started to try and identify the root cause. If the hives are particularly itchy or bothersome, we can treat them with antihistamine medications to reduce the symptoms. 50% of chronic hives will resolve over 3 to 12 months. Another 40% of chronic hives resolves over 1 to 5 years. Only about 1.5% of patients have hives for more than 20 years. Close to half of patients who get chronic hives will have a recurrence in their lifetime. Tests are seldom necessary. When do I need to bring my child back to the children's emergency? You will need to bring your child back to the children's emergency if you notice changes to the pattern of the rash. This includes appearance of blisters or purplish discoloration. You will also need to bring your child back if you notice symptoms suggestive of anaphylaxis. This includes change of voice, itchy throat, difficulty breathing, vomiting, and abdominal pain. Thank you for watching this video. We hope this helps you understand hives better. Bye bye!